Is it depression, bipolar, or ADHD? If you see a question where a patient feels sad, distracted, and can't focus, don't rush to pick depression. The ANCC loves to hide bipolar and ADHD inside those same symptoms. Let's break this down. You will meet many patients and exam questions that sound like depression at first glance, but as a future PHNP, your job is to look beyond the mood and trace the pattern. Let's talk about three diagnoses that overlap so often. Number one is major depressive disorder. Number two is bipolar 2, and number three is ADHD. Let's start with duration and pattern. For depression, it is heavy and persistent. It drags energy down for at least 2 weeks, often with fatigue and hopelessness. For bipolar 2 disorder, on the other hand, is a reading, high and lows. You will hear about nights of little sleep, burst of energy, or a creative rush that later crashes into sadness. What of ADHD? It is not about mood swings. This one is about focus since childhood. It doesn't come and go, it is wired in. For your exam, if the question says since childhood or lifelong difficulty focusing, think ADHD. If it says episode or periods of energy followed by crashes, think bipolar 2. If it says feeling down for months with low motivation, that is depression there. Here's one of the ANCC's favorite trap. A patient starts an SSRI and suddenly becomes agitated, talkative, and can't sleep. Your best answer there will be undiagnosed bipolar disorder. For your exam, when you see manic switch after antidepressants, think bipolar. Screen for bipolar before prescribing. Use the mood disorder questionnaire. It is small but powerful. It can save you and your patient from crisis. In real life, these distinctions matters deeply. You will see adults that have been labeled with treatment-resistant depression who actually have bipolar 2 or ADHD hiding underneath. That is why as a PMHNP, you don't just medicate, you investigate, you listen for patterns in sleep, energy, and history. Depression feels slow and empty. Bipolar feels rhythmic, like waves. ADHD feels constant and restless. So next time you see a VNEC that sounds like poor concentration and low mood, pause and ask, is this a state or a trait? Because that one question can help you earn points and protect your patient in real life. Save this if it helped you. If it helped you, share it with another PHNP studying for boards, and remember to study smarter and heal deeper. Follow me at Royal Pulse Health and Wellness wherever you watch content. Remember to subscribe, comment, like, and share.